Let's go ahead and get started. I don't know if you guys can hear me, but it sounds like they're going to turn up my mics because I'm a little too quiet. Before we get started, did anyone have any questions from before that might have come up? Yeah.
For children who are somewhat visually impaired, is there a recommendation for communication?
So repeat that, the whole thing again. Sorry.
If for children who are visually impaired, is there a recommendation?
For visual and hearing impaired? A lot of times there's providers that are trained to work with both, because recommendations sometimes will be different depending on the degree of loss for vision and hearing.
Okay.
So there's a lot of factors to consider. So I know there's another grant program right now training vision specialists in the area because there's not enough of them in this state.
Yeah.
And so that's in the works. So some new providers will be coming out of that will be trained.
But it'll be a while from now because they're currently being trained.
No, it's a year program.
Okay.
So like next year they'll be, maybe next fall.
Graduating out of there.
Because I think it started last summer, so they're finishing up this summer. Then after this summer they'll be doing well, yeah. So her question was asking if the recommendations would be the same if it's vision and hearing loss, which they would be a little bit different, and there's providers that are trained to really help with vision recommendations as well. So I'm going to finish up today by talking about spoken language and listening strategies. These are more based on Alexander Graham Bell Association, or LSLS. And again, there's a variety of charts out there, a variety of strategies and resources you can find. I tried to condense that information and organize it in a way. So you may see the information presented a little bit differently if you do your own research. So I'm going to talk about first awareness to sound, the strategies that you would use. The more strategies would be learning how to repair breakdowns, responding, and then other strategies. So before I talk about strategies, one thing I look at is the Erber auditory hierarchy. So the first skill is detection of sounds. Does the child know that sounds are there or not? If it's a severe to profound loss, this is more where we might have to work on detection, where implants are being considered. So you've seen those videos where the cochlear implant is turned on YouTube and these kids turn to sound. That's detection. They know it's there. They might not always turn the right way, and sometimes they don't even turn their head. Sometimes their eyes will go really big, like a deer in the headlights. So we know that they know sound is present or not. And sometimes at that stage they can't tell us, like, yes, I heard it, yes, I heard it. Sometimes they can. So kids with more mild, moderate, maybe even moderate to severe with hearing loss, they may already have this level of detection. Once they have detection, we may move on to discrimination. Can they tell the difference between two sounds? Can they tell me, are they the same or different? So if I give them a cow and a cow, can they tell me they're the same? Or if I give them a cow and a horse, will they know which one's which? Now, not all providers agree on what discrimination means. Some people say that from a field of two, so there's two objects or two things that they have to tell you, they have to pick from. So if I do moo for cow and I show them a cow and a horse, without them seeing my face, they would have to tell me it's the cow. They discriminate between two sounds. So that's what some consider discrimination of sounds. So then we go on to identification. So identification is when it's more than two. So if I have 3 or 4 animals and I do one sound and they have to pick. Because not only do they have to remember what the animal is, what sound it makes, and discriminate between or choose from a field of 4, from a field of 2 it's just much easier. 50% chance of getting it right as well. And so a lot of times I'll have patients that will be like, well, I know that's not, I don't know what a cow sounds like, but I know that's not what the cat sounds like. So they can tell, they do process of elimination. Even young children can do, I know that's not what this one sounds like, so it has to be that one. So discrimination's a little bit easier. Identification, you make it more difficult. And like I was saying before about the patient who I had from Africa, she could imitate every word I said, every sentence she repeated. She didn't understand it. This is more their level of identification. She could imitate, she identified the words, she identified the phrases, but didn't understand it. So that's the next level, that's comprehension. Comprehension is identifying, but understanding the language, understanding the concepts, having the vocabulary. So these levels are not, usually you would have detection, then discrimination, identification, and comprehension. But you could be developing detection in one area and developing identification in another area. So it's also kind of a continuum, a cycle. So it depends, because we know, for example, that when children are beginning to detect sounds, speech is easier. So they may be detecting, or they may be identifying different speakers. They may mom, dad, sister, but they may only be detecting musical instruments. So it depends on the skill. So this is the hierarchy I kind of look at when doing oral rehabilitation. So awareness to sound. So labeling the sound. It's called being a bird dog. So your child responds to sound, they look. It's an ambulance. So you give them language, you tell them. If you are doing spoken language, you would tell them a spoken language. If you're doing sign, you may do both. Be like, oh, that's an ambulance. You heard the ambulance. Good job. Way to go. They hear the door knocking at home. Oh, did you hear someone's knocking at the door? Let's go see who's there. So just giving them that language of being like, yep, you heard it. It's a door knock, or it's an ambulance. So kind of giving them what they're hearing. So sometimes children don't automatically do that beautiful head turn that we want, like the audiologists want to see in the booth. Sometimes that's something, or they're not aware, they can hear sounds, but they don't show us that awareness. So sometimes I have to teach them to respond. So I'll use what's called the hand cue. So if there's a sound that's present and they're playing, and if they don't look up, sometimes they hear it, sometimes they don't, we're not really sure, because they can't always tell us. So then I'll kind of get in their face and I'm like, do you hear that? Where's the sound? So I do a hand cue and I kind of point to my ear and cue to my ear like, I heard that. And so eventually we want kids kind of doing it on their own, like they hear a knocking or they hear a musical instrument and they'll be like, I heard that. Yes, let's look, where is it? So kind of teaching them to do that head turn, teaching them to be aware of sounds. Because like I was saying before, when it's novel and new, sometimes they'll respond, but once I do it 5 times, they've heard it already. Why do they need to turn around? But kind of teaching them and being that cheerleader of like, no, we want you to turn around. We want you to respond every time. But we have to really reinforce that and kind of give that cue, that hand cue. So an auditory sandwich. So this is when we give auditory information first, then we kind of show them the object, then the auditory information again. So for example, if I'm working on discrimination of sounds or just kind of giving them bombardment of sounds, teaching them the sounds, I may go moo, and I pull a cow out, I'm like, moo, do you hear the cow? And then I'll hide it again, I'll go moo. So giving them that auditory information, having them pay auditory first, and then kind of giving them the visual so they know what is making that sound. But then again, removing it so it's auditory again. So always giving that information or that label of what they're hearing. So sound object association, it's kind of like I'm saying, they start to attach meaning to different sounds or words. So if I have the animal sounds like I was talking about, they start to associate certain sounds with certain objects. So if they hear an ambulance sound and I'm telling them, oh, you hear an ambulance? They'll have that sound object association. And we can kind of teach them this through play or naturally throughout the environment, throughout the day. There's a variety of ways to do that, and you can do all of it too. So one way to really target listening skills in the beginning is songs. So something that we pay attention to first, which we all know this, babies do not always, they don't understand this right away. But they really pay attention to the melody of our voice. They like singing, they pay attention to that. We can hear different pitches and different rhythms and melodies before we really begin to understand speech. And so they really like the songs. And they can start to learn to do actions to songs. Sometimes we know that they know what they're hearing because we'll start singing, and then they'll do Twinkle, Twinkle, Little Star, or some action that we do with the song. Or Wheels on the Bus, they'll start pretending to drive a bus when they've heard the song. They may not know the lyrics or the speech sounds of the words, but they hear the melody and the pitch. So to highlight learning or to repair breakdowns. So acoustic highlighting, what I was talking about before, sometimes I'm trying to teach kids specific concepts they should know for their age. So for example, I started talking about the word heavy. I was trying to teach this little girl the word heavy, because that's one of the things she should know. And so we were playing with something that was obviously heavy, and I'm like, oh, that's so heavy. So I really put emphasis on the word that I want her to pay attention to. And I did it multiple times, like, do you feel how heavy that is? Can you lift it? It's heavy. So really highlighting that word acoustically, making more attention, making it more salient. So that way they're paying attention to it. And repetition, like I just did in that example. Repeat, repeat, repeat. Because they may not hear it the first time, and it takes us multiple times as learners to hear something more than once. So rephrasing. Sometimes they may not hear you the first time and say, what? So, like, it's time to go to the bathroom. And they're like, what? I didn't hear you. Time to go to the bathroom. So rephrase it. Do you need to go potty? So kind of changing the words that maybe they understand, breaking it down a little bit, just varying it. Ask your child to repeat what they've heard. Sometimes people who have hard of hearing are deaf. Sometimes they're a little nervous they're not quite sure what was said, so they might just say what. They might have an idea, but sometimes they'll just ask for clarification, but they did hear a little bit. So like if I said, time to go to the bathroom, and then the child's like, what? Okay, what did you hear? Bathroom? Okay, what do you think I'm asking you to do? Can you kind of do this or problem solve, figure out what I'm trying to tell you? So sometimes having that child pay attention to be like, okay, I heard this, what could it mean? Any questions so far? So these are responding strategies. So sometimes in therapy or in life in general, the kids don't respond. They don't talk the way we want them to, even though we know they can sometimes, because they can control it. And that's what little children love to do. So sometimes I use sabotage. So I'll pull out a cat or a cow and I'm like, woof, woof, woof. Obviously I know a cat and a cow do not woof, but children love to correct their parents. They love to correct their therapists. They love knowing what's right and telling you you're wrong. And I'm completely okay as long as they're giving me something. Like, fine, you can tell me I'm wrong all day long. And they think it's funny. And so I'll use sabotage quite a bit. Role reversal. Sometimes I'll have them, and this will give me an idea of what they know as well. I'll be like, okay, you tell me, what does the cow say? And they'll tell me. So just getting some information, having them be the teacher, kind of reversing roles, because they like that. They like playing. They like role-playing. They like to play the doctor or the teacher or mom. They love doing that. And so it's a good learning experience, and you get to see what they know, but you can also practice some skills at the same time. So one thing that's really hard is wait time. We all want to help the child, and it's so hard to wait. But this is a big one. This really teaches children that you expect something from them. You want that turn-taking that happens naturally in conversation. So for example, if I have a child who's maybe nonverbal and I blow bubbles, I'm going to wait for some reaction. If they don't do anything, I'm just going to be like, I know what they want, but I'm going to pretend like I don't until I get some type of reaction, and I'm going to shape that behavior maybe into gestures and then eventually maybe into words, attempts to say words. So I'm going to wait them out for a reaction. Oh, that's what you want. You want bubbles. Okay, I'll blow you more bubbles. And then they understand that they need to give me something. They need to give me some action, some reaction, so I know what they want. I'm just not going to anticipate their needs. So make it fun. Get silly. Be on the floor. Sometimes it's not easier said than done, but if you're not having fun, the child probably isn't either. So one way to help them respond better is to get their attention before you start talking to them. So there's many ways that you can do this. You can wave at them. You can kind of knock on a wooden surface or a hard surface. You can tap them on the shoulder if you're close enough. If you're further away, you can turn the lights on and off in a room and they'll pay attention. So just get their attention, say their name, have them look at you before you start talking. Because sometimes if you're talking to them, they catch midway and they only get half of it. So if you get their attention before, then they have more processing time and they're more likely to hear all of what you said. So other strategies to help them with listening is positioning. So if you're working more on auditory skills, you may not want them to see your face. You don't want those visual cues. But if you want to be on their better ear. So if they have a mild to severe loss in one ear and a profound hearing loss in both and have implants in both, most likely you're going to be, the better ear would be the moderate to severe ear. So I'm going to position myself, let's say that's the left ear. I'm going to put myself on the left side of them and kind of give them that auditory information on that side. Unilateral loss, we're going to want to be on the better side. So any type of hearing loss, and sometimes knowing what the better ear is, if their hearing loss is symmetrical, it's the same in both ears. It may depend on how their testing goes in the booth. It may depend on how they're doing functionally. You may, in therapy or at home in your daily routines, just kind of notice that they just do better on one side. So providing choices is very helpful for children who may struggle to communicate. And depending on their level, you can do this in multiple different ways. You can kind of give it to them visually. So if it's dinner time, okay, do you want spaghetti or do you want mac and cheese? What one do you want? You can show them the box. And then they can point. So they can communicate that way. But if they're further along, you may just be able to give them that auditory information. So when we ask questions, and they're more open-ended, meaning it can have any answer. So like I'll ask my husband all the time, what do you want for dinner? Open-ended questions. There's unlimited possibilities of what he can answer me. He's gonna be, I don't know. There's too many options, there's too many choices. It's more language processing when it's an open-ended question. So when I provide options, it's close-ended. There's a limited number of choices. It's less language processing, it's just easier. And it's a way to kind of generate that communication exchange. Like they get to, and they feel empowered too when they can make a choice. When they get a say and a decision in what's for dinner or what they get to wear that day. So book sharing is another thing that will increase auditory. So if you're reading, you're just giving them more auditory experience. Just talking to them, giving them more language. And then we've talked about this quite a bit, the optimal listening environment. So reducing that background noise, turning that TV off, turning the radio off. It is now summertime, so one thing to think about is windows. Is there a lot of traffic outside and some noise, or is it storming outside? Is it windy? Closing those windows, maybe turning on the air. So just ways to kind of help manipulate your environment if you can. Yes?
Starting out to work with spoken language and the optimal listening environment.
Mm-hmm.
Do you want to try to keep in that type of environment as much as possible, or is exposure to noise because of the world?
So when you're working on specific targeted skills, I would say reduce that background noise as much as you can at the beginning. But as they develop, you're going to want to, and they're doing much better and they're mastering those skills, you should start introducing. So she was asking, like, you want to get them used to like noisy environments, but do you do this when they're learning new skills? So when you're learning new skills, it's best to do it in a quiet, optimal listening environment. But if your child is also struggling to hear, you may think to yourself, oh, time to shut the window. So just something to be cognizant or aware of. So when they're struggling, what ways can you do? What can you do to help them? Yes?
I just started another. I found this on my own, but I literally lay with my child in the dark at night when they're going to sleep.
Okay.
I leave his put earphones on, and we sing songs, and I make him repeat words back to me. And we're in the dark, he can't read my lips, and he's having to listen.
Yep.
So it was perfect time for quiet, and it was kind of like a bonding moment, and he's learning. And it
Yeah.
really has helped him with his speech. At night, it's just the dark, like, you know, we're laying there quiet and ready to go to bed.
Yeah. So she was saying that at night, she'll sing to her son before bedtime. Your son, right? Yes. Before bedtime, but the lights are off. And I'm like, well, wait, you said turn the lights on. If you want to increase, if they're having a hard time hearing and you want to increase their comprehension. But if you're working on their auditory skills, you want to remove those visuals. Turn the lights off removes those visuals. They're doing auditory only, they're having to listen. And kids love songs, they love doing that before bedtime. And so like incorporating some auditory things in your routine, perfect. And there's multiple ways you can do that in a day. Because I know we're busy. We've all these things we have to do that we have to get done. And so incorporating these things into your routine is the best way to really incorporate every day. So like I was saying, at dinner time, they can make choices. That's one way. But you could kind of turn away from them, not let them see your face, if they're at this level. Be like, which one do you want? Think of so wait time, even at dinner. They're in their high chair or contained in some way, most likely if they're under 3, in a booster chair. You can wait to give them more food until they ask for it. So that's going to get that language out of them. So that's a good example of using wait time. So you can use these strategies throughout your day in different routines. And again, that's something, if you're still in early intervention, that's one thing your early intervention provider should be helping you brainstorm ideas. What can I do during my day, during the daily routines to kind of work on language, work on listening, things like that. Other questions? Okay. So that is all I have for you guys today. But if you guys have any questions or any information, I can definitely talk about it. Yes?
Earlier you mentioned that that behaviors are a form of communication. What kind of strategies can you provide to us without knowing our children, obviously, to kind of help redirect that hitting or that aggressiveness that they're probably not trying to be aggressive, they're just trying to communicate, to kind of redirect them?
Yeah. So she was asking since sometimes behaviors can be communication. Sometimes it's being a child under the age of 5. But when it's that communication, sometimes I have a child that he would lay on the floor, he would try to spit, he would try to hit. For the time being, I gave him because I know he's frustrated. So for the time being, I gave him a way that was okay to be frustrated. So instead, he would hit the table instead of hitting me. So I'm trying to shape that behavior. I don't want him hitting the table, but we'll get there. But let's step by step. So now, instead of hitting me or going on the floor or spitting, he's hitting the table and he's mad. And then I'm giving him that language. I'm like, I know you're mad. I saw you hit the table. You're telling me you're mad. It's okay. You can be mad. What do you want? So then I might use some of these strategies to kind of figure out. So I'm acknowledging their feelings, giving them language so they kind of understand what's going on, give them a way that's acceptable in behavior. And then I'm going to kind of go back to some of these strategies, maybe give them options, maybe have them pull me towards it. Try to get them to communicate in a way. And once they've communicated, so say they wanted the bubbles and it's on top of the fridge. And they've pointed and they've tried to tell you and they've tried to say bah and you're still not quite sure what they want. And finally, you pick them up and they're pointing and you finally figure out it's bubbles. And you're like, oh, bubbles. You wanted bubbles. Thank you for telling me. So then you're reinforcing that communication attempt, like, okay, we made it through it. You wanted bubbles. I get it. And then maybe giving them another way, a more specific way to say bubbles if they can, or you might put the bubbles somewhere if you want in a place they can reach them. So, yeah.
What if it's something that you don't want them to have them, and they want it? How are you going to fight that constant
That becomes more behavior instead of communication. So again, giving them that language, like, I know you want those bubbles, but it's not time for bubbles. It's time for bed. So just kind of, again, giving them that language, like, I know you want these bubbles, but you can't have them. Because they can't always have what they want. And our goal is to get them ready for school and have them in school. And they can't be doing that in school, not when there's 20 kids in the classroom. So, other questions? Yes?
Some more examples of sound object association, like what does that look like in your practice when you're working?
So a lot of times when I do sound object association, I pick 15 different sounds. No, not, so I'll slowly introduce them. And so we'll create this box of these 15 sounds. We may start with 3 sounds or 6 sounds. So in this box, I may include ling sounds as one of them. The ling sounds we do, so u, ah, e, sh, s. You guys probably all know them by heart. Say them in your sleep. But I want to introduce those sounds because once they learn them, if they miss one of those sounds, if they start missing the baby, sh, I know they need to go back in to be reprogrammed or tested. Something's going on with their high frequency sounds. Because oo and are more considered low frequency sounds, ah and e are more mid, and then sh and s are high. So that's one of the reasons why I start to teach those ones first. So the way I create these boxes is, so like this sound would be the baby. It's really easy to find a baby doll. This sound is a snake. I'll get a toy snake from the Dollar Tree or wherever. Would be an ice cream. Ooh could be a train or a ghost. Trains are easy to find. And then E's a little bit harder. Sometimes we'll do a mouse or a slide. A little bit harder, but you can find cat toys for mouse. So that's a little bit easier. The slide's harder. I can't find one for under $20, so. And then is the airplane. So sometimes I'll start, because that's sound object association. And that serves a dual purpose of like, okay, I can assess where your hearing's at today in your daily listening check. But then I'm going to add other sounds. But I'm going to want a variety of sounds. So for example, if I do woof woof versus moo, moo is a long sound. Woof woof is short and broken up. So I'm working on those suprasegmental cues. Those vary by duration, by rhythm. One's long, one's short. So I'm also going to do, if I have like moo and neigh, moo would be more low frequency, neigh might be more mid-high. So it's getting, when they struggle with certain animal sounds, I know as a provider, like, okay, this is the frequency they're having a hard time with. I'm going to go back to your audiologist and say, can you look at this frequency? Something's not going on here. So a lot of times we'll do animal sounds, but we try to individualize it for the child and the family. Say they're obsessed with cars or trains, like a lot of children are. So I'm going to have the same sounds in the same box. So the red car may say vroom, but the green car says beep, beep. One's long, one's short and repeated. So you just, and it can be, so when I was doing this activity in Africa, their cows don't say moo. I can't remember what they say, but it's very different. And so to me, I was like, I don't care what your cow says. I really don't. It just needs to be consistent. So for example, in English, we say woof woof for the dog. In Spanish, we say wow wow. And so it does not matter to me if you say wow wow or woof woof, just be consistent. So you can really choose what sounds you want in your sound object association. Usually we pick animals or cars because that's what kids are interested in, and they really, what draws their attention. And it's what we have in the house too. We already have those toys at home, so we might as well, instead of buying more. Ooh. It's one of the ling sounds. So ooh, or some people use a ghost, but sometimes the kids will throw the ghost back at me, so I tend to use the train more often. So, any other questions?
You put those then, like, say you put the red and green part in the box.
Yeah.
And then you say which one says
So that, I mean, you might have to write this down to remember like which one says which. But Yeah, you're gonna have to, because I know I would forget. So I'd be like, all right, let's write this down and like,
That would be the activity, right? They would pull the red car.
yeah, so if I have two cars, vroom and beep beep, and I go vroom vroom, I want them to pick the red car that says vroom. So, but you may want different, that's gonna be hard to remember for the child to remember, but you have to meet them where they're at. So if they're only gonna play with cars, I might try to pick different vehicles. So the bus, which is obviously different from a car. So the more different they look, probably the better. But again, it depends on what you have in your house and what they're interested in. If they hate trains and buses and only do cars, then you're gonna work with cars. Other questions?
Is it something normal, like for my son, when he sees the plane, he'll make the sound, but for the fire ambulance truck or fire truck, but he'll not make the sound.
So the sounds you're describing, so the pig sound, ah, that's easier. So we, those are two vowel sounds together. That's harder.
But he'll make the, make
But he's-
his movement.
He's probably, it seems like he's copying, he'll do like a hand cue to kind of show like, oh, like, I'm doing it, I'm doing the movement. So either he's not hearing it, or maybe it's just too difficult to voice, because it's two vowels together, it's harder. Then is an open central vowel, it's just easier to do. E is a higher vowel with your, it requires more tongue movement. And so it's kind of hard to say, is it because it's harder to say or you can't hear it? So then I would do like, I would put the pig and I would put the fire truck and I would say it. And if he can find it, it's not hearing. But if he can't repeat it, that might just, he needs to work on that E sound. And so sometimes it's kind of teasing out, is he not hearing it? Or is it just harder to say, it needs more practice, more exposure? Because E's a little bit harder to say. Other questions? All right, so I did, oh, more questions over here.
Tiene en las frecuencias altas,
with
casi no las
her
escucha.
daughter, high frequencies she cannot hear,
O mínimo. o sea,
very little on the high
prácticamente no las
frequencies.
escucha.
Okay.
Entonces ella
So,
podría lograr
Could she achieve
nada más hacer el sonido como de la S, como,
to make the sound of the S?
ajá, como esas palabras ella no las puede pronunciar porque no las escucha. Entonces
but she
podría,
can't pronounce it.
visualmente
Yeah.
enseñándoselas, ella podría aprenderlas.
Can you teach her somehow visually to voice it?
For that,
The
which sound?
sounds, like S sound or SH sound?
Son las altas frecuencias.
How old is she?
Almost three.
Oh, three.
So some of the ling sounds are developmentally easier to do, like ah, oo, they're vowels, they're open sounds. E's a little bit harder because of the tongue placement. Sometimes is a struggle because your mouth is closed. They're like, you're not making sound, your mouth is closed. And so sometimes I have to give them a tactile cue to feel that I'm voicing. But is one of the easier ones to teach with that tactile cue. S and SH, developmentally, we do not expect those sounds until they're about 7 to be mastered. Some children will pick it up before then, but if they don't, or they say it in a modified way, I'm not concerned. As long as I know they're hearing the difference. But if they get to the age, if they get older and older and still aren't producing that sound, then there are strategies to work on that sound.